Hi, this is Dr. Robert Peltier, Chief Medical Officer at North Oaks Medical Center in Hammond, Louisiana. Wanted to touch base with you guys to update you on our coronavirus changes and give you some more tips and tricks about how you and your family could stay safe during this unprecedented time. First, I would like to implore all of you, our blood supplies are desperately low. Please, if you can, donate blood. Today there is a blood drive at North Oaks Medical Center. Today is the 20th, and although this video may be past when that blood drive is done, our friends at the blood center certainly would be glad to schedule you to come into their center. It is safe to donate blood. They are distancing all the patients. They're cleaning the surfaces between patients that come in, or donors, I should say. So please do your part in the community. If you're young and healthy especially, you're the perfect candidate to give blood. One person's blood can save 3 lives. So if at all possible, please donate blood. I'd also like to give you an update on our numbers. Currently, worldwide, we're probably over the 250,000 confirmed case mark. 250,000 people is certainly a whole lot, and unfortunately we did pass today a sad milestone of greater than 10,000 people that have lost their life to this particular illness. In the United States, we're past 14,000 cases and 200 deaths. In Louisiana, we are past 400 cases as well, and have at least 10 fatalities so far. In Livingston Parish, we did have our first case confirmed yesterday. Here in Tangipahoa Parish, as of noon on the 20th, we still have not received any positive test. But again, I'm sure that we do have infected patients in the area. You should treat everyone as if they have it. Remember that the tests take about 4 days to turn around. So today I'll be getting my tests that were sent off from Monday. We have tested almost 200 people here at North Oaks over the past few weeks that have met the criteria and been sick. So far, again, we have none detected, but I'm convinced that some of those will come back at some point as a positive result. That being said, you shouldn't have plans to say when that happens, I'm going to change my habits. Your social distancing still is important to practice today. Those social distancing techniques include things like making sure you're staying at home as much as possible. Plan ahead. If you need to go to the grocery store, do it as few times as possible. Don't keep going back every day or every couple of days. Try to buy a week's worth of groceries or more if possible. Even my own mother, I asked the other day, I said, listen, if you got to go to the pharmacy, call ahead. Most prescriptions can be, you can get a 90-day supply of prescriptions. Be assured that it is probable, not possible, but probable that this will last past the 30 days that are currently being asked of everyone. With the experience in China, they've done really well, but their social distancing is now 2 months into what they started. So please act as if this may be a little bit longer. Prepare, plan, be smart. We do want to talk about even some of the social distancing changes that are coming here to North Oaks. As you know, we've changed our visitor policy previously to screen visitors coming into our facility, only allowing certain numbers in. We are changing our visitor policy starting tomorrow morning for those people that are in contact isolation. Contact isolation are patients that have many types of illnesses, not just flu-like illnesses, but Clostridium difficile is a GI bug. There's many things that we put people in isolation for. Why are those patients different than others? Because those are the patients that we are required as healthcare workers to protect ourselves, to use our very valuable N95 masks, sometimes all of our PPE, our gowns, our gloves, and we're starting to get critically low on those supplies. Therefore, for those patients, we just ask that the visitors understand that we're not going to be able to allow that PPE to be used, so unfortunately they also will not be allowed to be visitors. at our facility, or they will not be allowed to have visitors at our facility. In addition, when we get local spread, we will move to a no visitor policy. That means all of our patients in the facilities, with a few exceptions, will not be allowed to have visitors. That accomplishes a number of things. That accomplishes the amount of people moving in and out of our facility that may either introduce COVID into the facility or possibly have contact with a patient and bring it outside of the facility. Minimizing movement and interaction between people at all levels, whether that's why we shut down restaurant, except for takeout, but we shut down restaurants and bars and a lot of the things where there's a lot of interaction. It's the same principle here. Of course, there are exceptions to that rule. We understand there are things like pediatric patients, they can't be here alone. People that are in labor are certainly going to have their spouse, significant other support. One person will be allowed for those instances. We came into this business because we're compassionate people. We also understand end-of-life care is tough, and we will certainly make exceptions for those families when we have one of our citizens that is getting close to the end of their life to allow some type of visitation, but it will be on a limited basis. I'd also like to make a plea as social distancing comes forward that the psychiatric support that we all need. Everybody's a little bit anxious, and the people that we lean on, our friends and family, you still need to get in contact with, just not physical contact. Take this time to find an old friend that you haven't talked to in a long time. Call and check on them, especially our elderly population who are at home. I've called my mom and dad personally more times in the past week than I have it probably in the past month, and shame on me for that. But at the same time, the emotional support that all of us need. So, you know, a lot of us are home. Take the added time to touch base with people we hadn't touched base with in a long time. College friends, high school buddies, all those kind of things. What a great time to check on how they're doing and make sure that we still have the social interactions that we need as humans to keep us psychologically and psychiatrically healthy. So please check on all your friends and family. And we again ask you to, as much as you can, get information. Please go to www.northoaks.org/coronavirus. We have a Facebook page, we have a Twitter account. All those things have lots of information where you can gain valuable resources and see the other videos that we put out. Send us questions on Facebook or Twitter, and we'd be glad to create some videos to answer your questions on any subject. We're glad to answer any kinds of questions because knowledge is power. Thank you.